Mama's milk is good. A case for exclusive breastfeeding. In this presentation, I will be discussing the recommendations for breastfeeding, the benefits of breastfeeding, the factors that influence the initiation and continuation of breastfeeding, and how to increase breastfeeding among mothers. The American Academy of Pediatrics recommends exclusive breastfeeding for 6 months, with continued breastfeeding for 1 year or longer. According to the Center for Disease Control, or CDC, only 22% of infants in the United States meet this recommendation. What is so special about breast milk to have such a recommendation? I'll go into more details in the next slides, but briefly, it is incomparable to any commercial formula. It provides the infants with antibodies, white blood cells, and anti-inflammatory agents that protect the infant against numerous illnesses. The importance of breastfeeding. There are financial benefits of breastfeeding, infant health benefits of breastfeeding, and maternal health benefits of breastfeeding. Breastfeeding provides a substantial financial benefit when compared to the cost of buying formula, because breastfeeding is free. In this chart, we see the average ounces per day that an infant drinks. And in this chart, we see the average cost for a low-cost formula and a high-cost formula for 1 day up to 12 months. The average cost of a formula in the middle between a low and a high for 6 months is $1,045.59. The average cost of formula at 1 year is $1,990.17. Now, if you think about infants with a special diet, such as lactose intolerant or gluten intolerant, those formulas can be very pricey. So if we look at the high-end cost of formula for 1 year, that's $3,163.86. That's a lot of money for feeding your child when you could do it for free by breastfeeding. Infant health. Infants receive a plethora of health benefits from breast milk. Such benefits include, but are not limited to, reduction of childhood obesity, reduced risk of SIDS or sudden infant death syndrome, reduced risk of infectious diseases during infancy, reduced instances of diabetes, reduced instances of asthma, and protection against ear, throat, and sinus infections well into childhood. So some of the infant health benefits benefit them immediately in infancy, and there's even benefits that continue to benefit them through childhood. Think about this. These benefits are truly incredible. Many parents are terrified of SIDS. It is so unexpected and cannot be explained. But what we do know is that there are certain things that can reduce the risk of SIDS. One of these is breastfeeding. You can also think of ear infections and how awful it is when a child has them. Breast milk is a protection against these infections. Next, maternal health. For mothers, the health benefits include, but are not limited to, reduced postpartum blood loss, decreased instances of postpartum depression, increases in weight loss, and reduced risk of ovarian and breast cancer. These are huge for a mother who doesn't want to decrease their chances of getting postpartum depression or increase the rate that they lose weight after having a baby. So what about the other 78% of infants who are not exclusively breastfed for 6 months? What reasons do you think influence whether or not a mother breastfeeds or stops breastfeeding after she starts? It's important here to note that 80% of infants are breastfed at least once. So what happened? Why did those mothers stop? The main reasons include maternal employment. So if a mother knows that she has to go back to work after having her child, that will influence whether she starts or continues to breastfeed. Lactation problems. If the child has a difficult time latching on to the mother, or if the mother has mastitis, or if there's concern of insufficient milk supply. Social norms. What does society think or say about mothers breastfeeding? Lack of support. Is your spouse supportive of you breastfeeding? Are your extended family members and friends and healthcare providers supportive of breastfeeding? Lack of knowledge. Do you know how to breastfeed? Do you know what it entails? Do you know the benefits of breastfeeding? And health problems of both the mother or the child. And we'll go into more detail of each of these in the following slides. Okay, so first is maternal employment. Returning to work after maternal leave is a significant factor influencing the initiation and continuation of breastfeeding. Why or how does returning to work influence the decision to breastfeed? Frequently, this is due to the inconvenience of breastfeeding or pumping while at work or an unsupportive work environment. In countries such as Canada and Norway, mothers are provided 1 year of paid maternal leave. So this removes the issue of how to breastfeed or pump while at work. But the US provides only 6 weeks of paid maternal leave, which means that mothers must learn how to breastfeed and pump while at work. They have to figure out a new work schedule and start pumping before they go to work. And this can be a burden for some mothers. So what mothers can do so that they can continue to breastfeed their child when they return to work? First, they can talk to their employer about breastfeeding and pumping plans. Under the Affordable Care Act of 2010, employers must provide employees reasonable break time in a private location, not a restroom, to express milk for a child younger than 1 year old. This is approximately 3 times a day for an 8-hour workday. If you are pumping, learn how to properly store breast milk. Start pumping before you go back to work so that you have a supply ready for your child and so that you're comfortable pumping. If you live close enough to the office, you can breastfeed during your lunch hour. Now, the Affordable Care Act of 2010 does not allow break times for moms to breastfeed, but they can pump during those break times and then they can breastfeed during lunch. The next thing we'll talk about is lactation problems. So the first lactation problem is failure or difficulty latching on by the infant. Encountering problems with lactation can be discouraging and may affect continuation of breastfeeding as well as initiation of breastfeeding with future children. So failure or difficulty latching on by the infant. Incorrect latch versus a correct latch. Some immediate signs of an incorrect latch are maternal pain or discomfort, lack of swallowing sounds from the infant, and frequent head movements of the infant. So if the infant is not latching on correctly, they're not going to be getting any milk. So that's why you won't have any swallowing sounds. And they're going to move their head around because they're not latched properly and they're trying to get that milk. So they're moving their head around trying to figure out how to get that milk. Later signs of incorrect latch is mothers will have continual pain in the breasts or nipples. Infants will have poor weight gain, and mothers will have low milk supply. Mother's milk comes on demand, so the more that the child drinks, the more milk the mother will produce. So if the child is not getting any milk due to incorrect latch, then the mother will stop producing as much milk. Get professional assistance if you are not sure what to look for or if you do not feel that your infant is latching correctly. Professional assistance can include a lactation consultant, a physician, or a nurse. The next lactation problem that we're going to discuss is mastitis, which is a painful inflammation of the breast characterized by tenderness, redness, fever, fatigue, body aches, and headaches. Contributing factors of mastitis include an incorrect latch, cracked nipples, use of a manual breast pump, blocked milk ducts. So what can mothers do if they get mastitis? First, do not stop feeding from that breast. If you stop, milk can pool in the ducts, which creates an abscess. Also, use a warm compress. Massage the breast and take antibiotics as prescribed. Make sure that if you have mastitis, you are in touch with your doctor and do what they say. The next lactation problem that we'll talk about is insufficient milk supply, or not producing enough milk for your infant. Concern about sufficient milk supply is a frequently cited reason for stopping breastfeeding. Insufficient milk supply can result from infrequent feedings. So if you don't feed your child often from your breast, so if you do breastfeeding and bottle feeding, poor breastfeeding techniques such as an incorrect latch, and then also lack of confidence in breastfeeding or not understanding the physiology of lactation can lead to perceived insufficient supply when in fact there is sufficient supply for the infant. So unlike when you feed your infant in a bottle and you can see how much the infant is getting, when you're breastfeeding you can't see how much they are getting. So sometimes this causes mothers some concern and then they worry that they're not producing enough milk. If you're worried about this, talk to your child's pediatrician. They'll know if the child is gaining enough weight or if they're not gaining enough weight. And they may be able to help you figure out why you have an insufficient milk supply, if it's an incorrect latch or if you're not feeding frequently enough. But if there's any problems, always talk to your physician. The last lactation problem that we're going to discuss is nipple confusion. So pacifiers or binkies may interfere with breastfeeding. This is called nipple confusion. So it is discouraged that for the first 3 to 4 weeks of life, you do not give your child a pacifier or binky. You want your child to be familiar with the breast and not be using another form of nipple that can confuse them. But after 3 to 4 weeks, once the child has become familiar with your breast and is feeding properly and latching correctly, then pacifiers are recommended because they can help in risk reduction for SIDS or sudden infant death syndrome. But just make sure that for the first 3 to 4 weeks, you don't use a pacifier. And this is something that you should talk with your healthcare provider about so that your child is not given a pacifier right after birth. Okay, social norms and perceived public acceptance of breastfeeding. So how does the mother, her support system, and her community see breastfeeding? Is it acceptable to breastfeed in public? Should the mother cover up? Society's attitudes towards breastfeeding can influence the initiation and continuation of breastfeeding. Studies have found that concerns and embarrassment about breastfeeding in public or perceived norms and opinions of the general public can hinder mothers' efforts to breastfeed. So if a mother doesn't feel that she can breastfeed in public, she's not going to feel like she can run errands or go out, and that can cause the mother to just not breastfeed at all. In the United States, bottle feeding is often considered the norm, which makes it easier for mothers to choose the bottle feeding over the breast. Widespread exposure to substitutes for human milk is largely responsible for the development of this social norm. So it's important to understand what society thinks or how they view breastfeeding. If they view it negatively, then that's going to severely impact whether or not the mother will breastfeed or continue to breastfeed. It's hard to do something when everyone is against you or against that decision. Lack of support. Having support for breastfeeding or an example of successful breastfeeding increases the likelihood of a mother initiating and continuing to breastfeed. Oftentimes, the most influential source of support or opposition is the infant's father. especially if the mother and father are together or the father has an active role in the child's life. In being supportive of breastfeeding, fathers help the mother breastfeed more successfully. In addition to the infant's father, support or lack of support from medical settings and professionals can also influence the mother's choice to initiate or continue breastfeeding. So after you have your child, how does the hospital view breastfeeding? Do they allow the child to stay in the room with the mother so that she can breastfeed on demand? Do they give the child a pacifier, which can lead to nipple confusion, as discussed earlier? Other sources of support include the parent's mother or other extended family members, lactation consultants, friends, or support groups. So it's important to get a good support group, whether it's a formal support group or friends or family members or a lactation consultant or a physician, your spouse. It's important to have a support group so that you have people to turn to when you're struggling with breastfeeding or when you need help, or just to see that you're not alone in doing this. Lack of knowledge. So why is breastfeeding the best option? Could you answer that question before going through this presentation? Most mothers in the U.S. know that breastfeeding is nutritionally the best option. They often, however, cannot explain why this is the case. They can't give specific benefits of breastfeeding or the risks of not breastfeeding. So it's important for mothers to understand the importance of breastfeeding. Further, it's frequently assumed that breastfeeding comes naturally. And when you think of something coming naturally, you think of it as being easy. Mothers may not be certain on what to expect, nor how to actually breastfeed. Breastfeeding is an art that has to be learned by both the mother and the child. It's not something that comes naturally. Breast milk comes naturally through our body, but learning how to breastfeed is something that takes time for both the mother and the child. Inconsistencies between expected and reality is a main reason mothers stop breastfeeding within the first 2 weeks. So if the child has difficulty latching, that may lead the mother to stop breastfeeding altogether because it's not coming as easily as she thought it would. Or if her nipples are sore, or if she's just not sure she's doing it right, that can all lead the mother to stop breastfeeding because it was not going how she expected it to go. Health problems. Health problems include physical, mental, or emotional health problems of either the mother or the child, and they can deter a mother from breastfeeding, even if doing so would be her preference. So there's only a few medical conditions in which breastfeeding should not occur. Some of these conditions, however, allow mothers to pump but not directly feed. Some allow alternating breastfeeding and special formulas, and some prohibit any breastfeeding or pumping. Additionally, there is the possibility of other medical conditions on the part of the mother and or infant that can interfere with breastfeeding. If there are any concerns, the mother should talk with her or her child's doctor. So if you're worried that you have a condition that will interfere with breastfeeding, or your child has a condition that will interfere with breastfeeding, just make sure that you're in contact with your physician or with your child's pediatrician to see the best way to go about feeding your child. In addition to physical health problems, mental and emotional health problems include postpartum depression, high levels of maternal stress or anxiety, and etc. Health problems or potential health problems and whether or not it affects breastfeeding should always be discussed with the physician. Okay, so throughout this PowerPoint, we've been discussing the importance of breastfeeding and things that lead moms to stop or not even start breastfeeding. So how can we increase exclusive breastfeeding among all mothers? First, mothers need to become educated about breastfeeding. This includes proper techniques of breastfeeding, the benefits of breastfeeding, and the recommendations of breastfeeding. Such education can come from lactation consultants, courses at the local hospital, nurses and doctors, their mother or other close family members, close family friends who have successfully breastfed, scientific journals or articles, Center for Disease Control, and the American Academy of Pediatrics. There is so much information out there about breastfeeding, and it's important that mothers have accurate information so that they can become educated properly. After mothers are educated about breastfeeding, they need to educate their support system about breastfeeding and their desires or intentions to breastfeed. Their support system includes their spouse or the infant's father, parents, extended family members, healthcare providers, and so on. Going to breastfeeding courses with your spouse or other support system members, reading articles together, teaching them what you have learned, and so forth can help them be a better support to you when you start breastfeeding your child. Mothers also can receive professional support from certified lactation consultants and other healthcare providers. If you're worried about any part of breastfeeding or have difficulty, get help. There are so many people out there that are willing and able to give you professional support so that you can have a good experience breastfeeding and your child can get the nutrients they need from your breast milk. For mothers that are on WIC, Women, Infant, Child, breastfeeding consultants are part of the help you receive. Don't hesitate to reach out and use them. Don't be embarrassed. They're there to help you and your child. If applicable, discuss the break time requirement with your employer. Prior to the baby arriving, take time to discuss with your employer your desires to breastfeed and what your needs will be, such as a private clean space to pump during breaks and a place to breastfeed during lunch, and so forth. Make sure your employer knows what your plans are. If your employer is not supportive, get help from higher up the chain, from fellow employees, from your spouse, and so forth. It is the law that they allow you a place to pump and that you can feed your child during lunch. So make sure that they are following that law and get the help and support you need. Lastly, seek out hospitals and healthcare providers that are supportive of breastfeeding. When you start looking for a doctor, discuss with them your desires to breastfeed and what that means for post-delivery. Make sure that they understand that you want your child in your room so that you can feed on demand, that you don't want them to be given a pacifier for the possibility of nipple confusion, and so forth. If your doctor is not supportive of that, maybe it's a good idea to look for other providers. With the known health benefits of breastfeeding for both mother and infant, breastfeeding should be considered a public health concern rather than a personal lifestyle choice. While it is a choice that the mother will make, more mothers need to be aware of the benefits of breastfeeding so that they can make an educated choice. Lastly, you are not a failure. This is very important, and despite all that has been discussed regarding the importance of breastfeeding and its superiority over formula, it is important to note and to recognize that there will always be mothers who, for some reason or another, will not breastfeed. Being a mother is hard and stressful, regardless of if you breastfeed or formula feed, so one does not need to add to the stress by feeling like a failure for not breastfeeding. Making the decision to breastfeed or formula feed is one that needs to occur between the mother and her support system, which should at least include a healthcare provider. But ultimately, making the decision to breastfeed or formula feed falls on the mother after seeking out advice and scientific knowledge. To share an example of making such a decision, a good friend of mine was very diligent in exclusively breastfeeding her first 2 children for 6 months, and then continued to breastfeed them with the addition of solid foods and the occasional formula bottle. When her second child was 11 months old, she found out she was pregnant with twins. This was not planned. In less than 10 months, she and her husband would be the proud parents of 4 children under the age of 4. She was excited beyond measure, but also feeling extremely overwhelmed with the thought of so many little ones, especially after family members leave and her husband returns to work and it's just her at home during the day. After much discussion with her husband, they decided that for her sanity and the sake of her 2 older children, she would forego breastfeeding and exclusively bottle feed the twins. Several people commented on her decision by asking how she could switch sides, or if she really thought it would make that much of a difference to her sanity. Becoming parents, whether for the first time or for the 3rd and 4th time, should be a joyous occasion, not one filled with insecurities and shame about their first major parenting decision. So yes, I am 100% for breastfeeding, but that does not mean that we can demean or be judgmental of those who, knowing the facts, still formula feed. We must be respectful and supportive. My concern is with parents who make a decision without knowing the facts and who do not educate their support system prior to making a decision. As long as the mother is educated and has made an informed decision, the decision is hers. These are all the references I used to compile the information found in this presentation. Thank you for your time.